Just when you thought the face masks can be thrown away, China's COVID surge sends alarm bells ringing. China is witnessing a new COVID variant due to the rise in the cases of the BF.7 COVID variant. And here's a few questions which may pop up in your mind. So what is this new variant BF.7? And are the available vaccines useful? Are they helpful? And how to prevent yourself from this virus? BF.7 in India is a variant of concern. Is it? Well, let's understand further. As is evident from the COVID situation in China, the BF.7 variant has the highest transmission ability. BF.7 is a sublineage of the Omicron variant BA.5, has the strongest infection ability, has a shorter incubation period, and is quicker to transmit and infects people easily. It is also found that the variant affects individuals equally irrespective of their vaccination status. The high transmission rate of the BF.7, taken with the risk of the hidden spread due to many asymptomatic carriers, is understood to be causing significant difficulty in controlling the epidemic in China. COVID outbreak in China. Experts predict more than 60% population will be infected in China over the next 90 days. It will also affect 10% of Earth's population. COVID is spreading faster than ever in China. 800 million could be infected this winter. The BA.1 and BA.2 subvariants of Omicron were responsible for the January 2022 wave in India. However, India experienced only few cases of BF.7. Now, the global concern around the COVID situation in China has increased. In India, 3 cases have been found so far of BF.7, 2 cases in Gujarat and 1 in Odisha. So are the vaccines effective on the BF.7? Well, the virus has mutated many times since the beginning of 2020. As per reports, the Omicron variants are known to evade the immune response from most vaccines currently in use. However, getting vaccination is still advisable as it prevents death, as per medical experts. Now, how does the transmission happen? The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette. There's a huge uproar due to the current tsunami of COVID's latest variant in China. Chinese government is trying to hide the severity of the pandemic. Whereas in China, hospitals are overwhelmed with patients. Morgues are full of dead bodies, and funeral vehicles are lined up outside the crematorium. Delivery workers are lined up outside pharmacies to collect the medicines. So should we prepare for a horrific new COVID wave? Now let me tell you how India plans to stay ahead of the game. PM Modi has already completed a high-level meeting on COVID-19 situations across the country. Health ministers has already shared a detailed presentation. He mentioned that quarantine structures may return along with mask mandate. PM Modi also shared few advices for the state to follow and be prepared. Center has already issued guidelines to state. Indian Medical Association has also issued an advisory. States have been advised to do genome sequencing, a technique used to identify and understand the characteristics of new virus strains. Random sampling at the airport has also started for those who are returning to India. States have been advised to strengthen surveillance and ensure operational readiness of hospitals. Now let me tell you that India is not at a risk yet, and it might not be. But we still can't afford to let our cards down. Now it's not just the government which has to fight the war against COVID, but we all need to follow the COVID appropriate behavior. Thank you for watching. But before I go, I suggest mask up India.